Assassination of John Fitzgerald Kennedy. We are also privileged tonight to be joined by a person who was an eyewitness to history, Nurse Phillis Hall of Dallas, Texas. On the night or the afternoon JFK was shot, she was at Parkland Hospital, which is where the president's motorcade street to after the president was shot. Thank you so much, Nurse Hall, for joining us today. I know you'd like to be Thank you. Welcome to City College. Let's start, if we could, with the day the president was shot. Just take us back in history and tell us how you learned the president's motorcade was coming to Parkland Hospital.
I want to clear up just one issue before I start. My name does not appear on any record of having had any thing to do at all with the care of the president that day. I had worked, that was my first job out of nurse's training. I had worked in the emergency room for 4 years. We had a young family at that time, and so I had, in order to have better hours and spend more time with them, had transferred over to the outpatient clinic department. And that's where I was working on the day of the president's assassination. We had known since September that the president was going to visit in Dallas, and we were a little surprised and a little leery about him coming there because Texas at that time was not really very hospitable or a warm place for a Democrat to come. But there was a lot of problems going on in the Democratic Party, and some of the candidates that visited there before did not get a warm welcome. So we just have to face it that Kennedy was a beloved president, and I think he thought that by coming to Dallas that he could smooth the waters there and make things better for the Democratic Party. But I digress. That morning it was very cold and rainy. I went on into the hospital, and as I say, I was working in the outpatient clinics. That morning I was scheduled in the surgery outpatient clinic. Things were going along quite well, and the patient load was a little less, but I had noticed, and other people had spoken about, when something exciting was going on in Dallas, the patients didn't feel necessary to keep their doctor's appointments. So that morning, they had, even though the weather was terrible early on, I had gone down to watch the president. About 10:30 in the morning, I was looking out the window, and all of a sudden the clouds just broke apart, and the sun just came through just beautifully. And the sky was as blue as I'd ever seen it in Dallas, Texas. So as I looked out that window, out of my right eye, I could see this airplane coming into view. And the path to Dallas Love Field, which is the only airport that we had at the time, came right by the hospital. So we watched this plane, everything just kind of stopped back there. And we watched as this plane came by, and I mean the sun just danced on the silver blue fuselage. And it was about a city block away and almost at eye level by the time it came past the hospital, and we could see the president's insignia on the side. One of the doctors, just kind of in a whispered afterthought, said it would be so easy to get a pot shot off of that plane. The morning went on, and so it was time for my lunch period, and I thought I would go over and see what was happening in emergency. And a friend of mine was working at the triage desk there in emergency that morning, and she was saying that they were slow too. At the time, I think the emergency room saw about 9,000 patients a month, which is just a very small amount now. It's about 15 or 20,000. But I hadn't been over there more than 10 to 12 minutes until a supervisor came hurrying from her office. And she came to us and she said there's been an accident in the president's motorcade and they're on their way here. Well, the words were no longer out of her mouth, and the doors just exploded. Now, from where I was standing, I couldn't see the entrance doors to the emergency hallway. They were enlarging the emergency room, so in order to see what was going to happen over there, I walked from the triage desk to the door that led to the back hallway that eventually went back to trauma room 1. There was a lot of pandemonium and screaming and yelling for carts and get out of the way, and it was just escalating. So normally when you hear somebody screaming for carts and everything, it usually means the lady's having her baby out in the car. And so one of the OB doctors took a carriage and put a precipitation tray on it, thinking he was going to deliver a car, and then a nurse friend that accompanied him outside said then they, of course, came up on the limousine. They started guiding people that I knew through the hallways there. The mayor of Dallas was the first person that I saw. And I knew who he was, but it was just sort of like watching something on television. It wasn't real to me. The next person to come through was Vice President Johnson. He at the time was having a lot of cardiac problems, and he was so pale and so sweaty that they thought he was having a heart attack, so some of the medical personnel was trying to get him on a carriage. Before I saw Governor Conley, I heard him because he was so gravely wounded, and actually it was just a miracle that he lived through his wounds. So they came with him on the cart. They had the back of the cart up because he was trying to breathe. The bullet had gone through a lung, through his wrist, and into a thigh, so I'm sure the pain was just unbelievable. They turned and came by me towards the triage desk. There was one unit where they could care for patients up there, so that's where they turned. And when they turned to come by me, every time he exhaled, there was just this bloody mist that covered all of us, and the floors and everything. As I looked in the hallway, this next cart, all I could see was a gentleman from the waist down, had nice slacks on. There were no shoes on his feet at that time. And as it got closer to me, I knew that that was Jackie Kennedy, and she was laying across the president's head and shoulders. She's pretty short, so her feet were dangling off his right side, and she had a hold at the far side railing on that cart to keep herself across his body. So they went on past, and I was, I don't guess, I was kind of numb by that time. And I looked up, and right in front of me was this gentleman, 6'2" or 6'3", and with both hands he was holding up this massive gun. I'd never seen one that big in my life. In fact, it was long enough that had he needed to walk through that door, he would have had to adjust this gun. And I think that it was Clint Hill. Now, I'm not sure of that, but Clint always took care of Jackie and was her security, and I think he was the gentleman that you see trying to climb across the trunk of the car towards Jackie. And he said, he just put his hand on my left elbow, and he said, "We need your help back here." So I didn't argue, I just went back there with him. I was probably about the fourth person in trauma 1 back there, because it had only taken 6 minutes, as I said, for that car to get from downtown Dallas to Parkland. And normally it would take at least probably 12 minutes. So the doctors that were up in the hospital hadn't had time to get down there yet. So I walked over to the cart and started feeling for vital signs, and felt for carotids, radials, and pedal pulses, and I detected nothing. This president was, in my estimation, dead on arrival. He was very cyanotic, which means he was turning blue-gray because oxygen was no longer circulating through his body. I noticed also this huge exit wound that was right under his Adam's apple and just above the notch here. At this time, even though the head wound was on the right side of the head, and that's where I was standing, the hair had fallen back down, so I didn't particularly pay any attention to that part at the time. We started getting tracheostomy trays there to try to put a tracheotomy in. They brought in chest tube trays, and those were also placed in, and by that time there were a lot of security detail, I'm told, that started gathering outside that room. But you may want to know also about Mrs. Kennedy, because she did stay in that room with him, and she stood at the foot of the car and kept her right hand on his left foot. And at one point, the supervisor asked her if she would not like to have a chair in the hallway. And the only thing I heard her say that day was, "No, I'm going to stay with him." We continued to try to find any little sign of life in this man, but it just wasn't there. One of the first doctors down, using his stethoscope, I think heard the last 3 or 4 beats of his heart. He also heard what we call agonal breathing, and that's just merely the body and the lungs getting rid of the air that's in there, because they no longer could process this through the body. People asked me also how long I was in that room,